This is the first time in my life I've been able to walk normally. I've always had some sort of a limp. Um, I walk, I stand every day. I am amazed by the surgery, what the surgery's done for my life. I can walk anywhere. I can do anything. I can sit down and sit on the floor, which I was never able to do because of my hip problem. My name is Janice. I had total right hip replacement surgery on April 8, 2019 at Ocean Medical Center. I've had a lifelong problem with my right hip. I had Legg-Calve-Perthes disease as a child and osteonecrosis of the femoral head as an adult. My right leg was 3 centimeters shorter than my left leg. So if I didn't really put anything in my shoes or anything like that, I had a limp. So I had a big limp. I would go side to side. I could barely walk. I mean, I was walking with a cane. I was trying physical therapy, but my physical therapy was not really doing any help for my condition, because my condition was to a point where my hip wasn't going to get better. It wasn't going to strengthen. It was deteriorating. I'd gone to Seaview Orthopaedics in previous years to have x-rays and just to kind of follow up. I could have been, put in with any of the doctors, but when I met Dr. Parcells, I was very confident in his abilities, and he was clear from the day one what my problem was. He knew that when I wanted to do surgery, that he would be able to take care of my deficit. I'm 3 months post-operative. I've completed my physical therapy. I'm able to walk, run. I'm able to do everything that I haven't been able to do in 50 years. My doctor says I have no restrictions, which I couldn't believe, but I have no restrictions. I'm able to do everything everybody else can do. I was able to take a walking tour with my son for college, which was one of my post-operative on my post-operative bucket list, and I'm going to keep going. I've got my little Fitbit to tell me how many miles I can walk.